Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Jason Carpenter, who's a seasoned executive in the aesthetic industry with more than 25 years of experience supporting innovation, clinical experience, and I see I said that wrong, clinical excellence and market growth. He holds a bachelor's of science in biology as well as an MBA, combining strong scientific foundations with strategic business leadership. In his role with Alma Lasers, Jason focuses on helping integrate advanced aesthetic technologies into the North American market. He works closely with physicians, practices, and internal teams to support successful technology adoption and long-term clinical success. A key aspect of his work involves collaborating with key opinion leaders to help establish, validate, and refine standard operating procedures and clinical protocols. Jason's approach emphasizes evidence-based practices and consistency, ensuring treatments are performed correctly to achieve optimal clinical outcomes and patient satisfaction. His deep industry knowledge and collaborative leadership make him a trusted resource within the aesthetic community. That was kind of a tongue twister, but welcome to the show.
You did a
Jason,
great job, and I'll be honest with you, full disclosure, that's AI generated. So God bless you for reading all that. You certainly didn't have to, but thank you.
well, my listeners got to know who I'm bringing on the show here. Tell us, Jason, your story. How did you land working in this industry and with Alma?
Yep. So look, I have a background in biology. I was a pre-med, pre-vet. I was going to be a veterinarian. I love animals, basically. My daughter's actually pre-vet now, so we'll see if I can live vicariously through her. She's in college, but I
Yeah,
was
yeah.
pre-med, pre-vet, and I got done school with a degree in biology, and I took like a year off just to kind of make some money and catch my breath and apply to vet schools because they're tough to get into. And I started wearing lasers honestly, back in 1997. It's been a while. They were more medical. It was more derm, to diagnose stuff and remove lesions, those kind of things. The cosmetic stuff came out much later, maybe in 2000, 2001. And I kind of thought it was like a fad. I was like, oh, who's going to pay for this? Like movie stars, maybe. But now it's like mainstream. So
Yeah,
I've been
yeah.
doing this now for 20 plus years. People are living longer. They want to look and feel better. So it's great. So I've been with this, in my role with this firm for about 20 years, but I love what I do. It's so interesting. I work at different places. Part of my role is when we bring stuff into North America, I kind of test out the protocols in our wellness center here to just make sure that the information we get from Europe and overseas is accurate. We're a global company, so we launch everything overseas first because we're based out of Israel. I work out at the Chicago Wellness Center here, but it's kind of like testing out the protocol. So I work with a lot of the top doctors in the country, kind of making sure that what we see is what we're getting, if that makes sense. So it's fun.
Yeah, yeah. So I wondered, like, obviously, with all the devices we brought on, they all are not made in the United States. But I was wondering, like, why is Israel the hub for aesthetics? And someone once told me, is that where like the crystals or something, does something come from that part of the
So a
world?
lot of the products, correct, come from Israel. It's us, it's Luminous. There's a bunch of other companies over there, basically. That's like the Mecca, basically, when you talk
Yeah.
about this kind of stuff. And yeah, some of the products and some of the crystals, like a YAG crystal, yttrium lumen garnet, it's easier to get overseas. Also, globally, it's easy to test things out without having the FDA regulations and those kind of things,
Sure.
basically. But a lot of the companies, it's almost like the coaching tree in football. They all came from one company, Coherent Medical, back in the 80s. And our founder, Ziv Carney, formed Alma. Another one formed a different company. There's one that formed InMode. They all kind of know each other and they work together in the 80s or 90s, if that makes sense.
Sure, sure. Well, we are a longevity, integrative functional medicine, whatever you want to call it, wellness clinic. And we just recently, in the past few years, started offering more non-surgical, non-invasive, needleless aesthetic treatments here at our clinic. So, in your opinion, like how are aesthetic medicine and kind of anti-aging now combining into this new wellness specialty?
I think it's great. My sister-in-law is an internist. He's a physician, basically. And like I said, we're living longer now, but we're living better lives, which is great, which is nice. So we don't not only want to look good, we want to function, basically. I always tell the story. My mother, 81 years old, she lives across the street. My dad died. We got her the house there, and she still teaches ballroom dancing. She's 81, still in great shape. Still goes out, walks
Oh,
the dog, and does everything. She doesn't look like she's 20, but she wants to look better. She wants to look in her 60s or wherever the kids are students, but she lived a healthy lifestyle, looked good. She doesn't want to look made up like what we had in plastic surgery years ago, basically.
uh-huh.
She just looked
Yeah.
like a natural, healthy version of herself. And I think that's what most people want. They don't want to look dolled up like they have a ton of surgery done and those kind of things. And that's not super healthy for us anyway. The implants, the injections, those kind of things. Our body gets rid of all these injections because we don't want them. We basically try to get rid of them. So I think anti-aging, wellness, cosmetics is all coming together, which is great, coming to a whole new discipline. I think moving forward, that's how it should be. It should be more of a proactive approach instead of a reactive approach. Before cosmetics was reactive, I have a wrinkle, I have a blemish, let me go get that fixed. Now it's more proactive. What's causing that? What am I eating? What side effects do I have? What allergies do I have? Those kind of things. And then we're able to kind of treat people quicker and better and longer, if that makes sense.
Yeah, yeah, good answer. So you're the expert on the Alma TED device specifically for hair restoration, which is the topic of today, which is the newest service we brought into the clinic that I'm particularly excited about because I was getting the service. It was costing me a half a day trip by the time I drove to another clinic,
Oh, I'm sure.
got the
Yeah.
treatment, drove back. It was like I just financially I just lost a half a day of revenue, to get my
Yeah,
hair
to get
treatment. So
treatment.
I needed to be able to bring this in for myself, but also for my patients. I mean, just thinking through the day, half my patients have hair loss. So it was definitely something that I thought would be successful for us. And it has been, I mean, really the quickest success of any of the devices that we brought on. So we had a TED event recently at the clinic, and not everyone could attend. We have a lot of distance patients. So I wanted to be able to put some of this into a podcast so we could have listeners, hear about what this is. So I guess let's start with the science and technology. So can you first tell us what this TED hair restoration device is?
Yeah, so basically, TED's an acronym. It stands for Trans Epidermal Delivery. Basically, it's super short ultrasound, and what it's able to do is deliver products through the skin. Our skin's here to kind of protect us. So a lot of the products that we put on our skin for skincare or our hair for hair care doesn't really get down to literally the root of the problem, the root of the hair, basically. So TED's a super short ultrasound machine that actually has some other technologies in there that we'll get into that will actually drive products through the scalp into the hair root. And that's the key to this. Like a lot of products that we get do work, but they're superficial. We need to get down to the hair root, feed it with nutrients, growth factors, these other things. And that's also what we're kind of infusing into the skin. So imagine having like a multivitamin for your skin, for your scalp is what it's doing. As we get older, we lose hair, not because of all this aging, it's because of lack of blood flow, lack of nutrients, those kind of things. As we get gray hair, the hair is just unhealthy. Well, imagine infusing it with what it needs. It needs polypeptides, amino acids, a bunch of stuff that we produce when we're younger, but as we're older, we don't really produce as much because of, aging, healthy lifestyle, those kind of things. So it's completely painless. It's easy to do, and we've had it overseas for a number of years. In North America, we mainly focus on hair, and I think you're right, Doc. So many people come in and we focus on skin, but I mean, having a full head of hair is so important these days. Even when you're younger, we treat a lot of young people in their 20s that have lost it either from COVID or from stress or you name it, basically. And originally we were thinking maybe it's the male market, it's the female market. It's probably 60-40 women, to be honest with you. I joke I'm married with 4 kids and we have 2 daughters, and me and the boys won't even go into the bathroom after my daughters. There's hair all over the place. They're shedding like you wouldn't believe. So it's been a great product for us, but the big thing is it's helping people. That just I feel bad because some of the people that have scarring alopecia
Yes.
areata, like just they didn't have an option, basically. And unfortunately, it's not socially acceptable for a woman to have no hair or shortcut. Where guys can shave their head and kind of do that, for women, it's not socially acceptable for them to have missing hair or very short
Mhm.
haircuts, typically, which isn't right, but that's how it is. So.
Do you know the hair loss statistics? Like, do you know how many individuals
So
worldwide or nation, or I mean, do you know any of that? I was going to look it up ahead of time and I forgot, but
yeah, I have it somewhere on a slide, but I was actually shocked when I started doing this study. I think 50% of people over the age of 50 have at least 60% hair loss. Like it's over 50%, which I'm shocked.
wow.
They have thinning hair basically. And look, I was called Ronald McDonald as a kid. I got lucky. I mean, I have a little curly hair up here and it's holding back. But I have a bunch of friends, women too, that, just have thinning hair after postpartum, those kind of things. But when I started doing the TED study, I was shocked that the market's so big, and it's 50% of people over the age of 50 or 60% of people have some kind of thinning hair or those kind of issues.
Well, I
And then
believe it. And, now I'm looking more for it. Like I was telling my husband in church the other day, like we're sitting in the back so I could see all the bald guy's head.
I
It's like,
know.
oh my gosh, we could help so many of these people. And then I was at a conference this weekend with some amazing speakers, mostly men, all of which were half bald. I'm just
I
thinking,
know.
I did
It's
not go up to
crazy.
them. I mean, I did go up to them to talk to them, but I did not say, hey, I have this treatment.
Well, no, no. And also, it's getting worse, especially for men too, because all the bio-T testosterone stuff, which is great, but if you
Yeah.
don't check those levels, too much testosterone creates too much DHT, and that also miniaturizes hair. So it's like a vicious cycle, basically, is what's happening. So it's crazy. So I was shocked too. I just thought that it was a normal sign of aging. You lose your hair as you get older, and it's not a big deal. I didn't think women really suffered from that much, but they really do. We have young girls that are in their 30s, and I'm like, you have a full head of hair. They're like, no, it's extensions or it's this, it's
Yeah,
that.
yeah.
Like, I'm actually surprised at how many women come in for treatments as well.
Yep, yep. So let's go back to what TED is. So, like, what's happening to the skin during treatment with this technology?
Yep. So basically, our skin, we have the outer layer, which is like epidermis, is what they call it. It's like brick and mortar. It's like this brick and mortar, and the dead skin cells are held together by what they call like a bilipid membrane. It's like a water membrane that holds things together and kind of locks everything in place. Think of it if you're looking at a brick wall, the mortar in between kind of holding it together. All we're doing is shaking those particles on the skin and allowing for that bilipid membrane to kind of open up. It opens up. It's not a clean channel like you would with like a microneedling or like a laser to kind of cause a big trauma. And that can work too, but we'll get into that. But this
Mhm.
just opens it up large enough where we can get a product through this channel. And it's not a smooth channel. It goes basically between the epidermis down to the skin. So all it's doing is breaking that apart enough where we're able to put a certain size product, molecular weight product, into the skin and get down to the hair root is the big key. You can try doing it with injections with needles, but that's an inexact science. I mean, if you're sticking needles into that, one, it's uncomfortable. Two, think about it. If it's a vellus or terminal hair, they're at different depths. Like, how can you get to a different depth in different areas and different areas? So we're just able to super saturate it. But the TED was used overseas to deliver other products. I mean, it was medical grade. We were delivering hormones, bleaching creams, hydroquinone bleaching creams, hyaluronic acid for hands and skin. In the US, we mainly focused on alopecia, but outside the US, they do use it for other applications for sure. It's just basically a delivery system. But what you're doing is you're breaking apart the skin on a microscopic level, no holes, no oozing, no issues basically. And it's open for a number of minutes. That's it, maybe, 30, 60 seconds, maybe 2 minutes. And then if you put the product in, the TED has a second technology besides the ultrasound that opens up the skin, and it actually has pneumatic air that drives it through. So it's actively driving this product through the skin to the bottom. And what we did as some of the testing is we added some tryptophan blue dye just to see so we can actually get to different depths and we can
Yeah, yeah.
actually super saturate the whole area, which is kind of neat. Instead of just having pockets, that if you do injections with like a needle, you'll have pockets of, areas. With this, we're able to super saturate the whole area with these polypeptides, amino acids, growth factors.
Let's talk about those. Yeah. So essentially the first step is opening up these channels, whatnot, opening up this brick and mortar. So then the second step is applying this TED hair care formula. So what are the growth factors? Like what are the nutrients in that serum?
A lot of them are stuff you're probably already using topically or you're already using, but they're just not able to get to the root. The big active ingredient is probably synthetic growth factors. They're vascular endothelial growth factor, VEGF, basically, which is popular in PRP treatments. There's also acidic fibroblast growth factor and a number of other amino acids. The big thing is the way it's synthesized. The molecular weight is small enough where we can drive it into the skin. You can't just grab like growth factors and exosomes off the shelf and just say, "Hey, I'll drive it in." They're just too big. Exosomes are like big saucers, basically. They won't get into the skin. So a lot of this stuff, when I talk, I'm like, well, a lot of my doctors are already using these ingredients. These are active ingredients that they're already using. They're using growth factors from PRP. They're using this.
Sure.
Why is this any better? It's just the molecular weight of them, and since they're synthesized in the lab, we can guarantee the quality of them and the cell count. The problem with PRP is, look, if you draw from, someone who's 25 or 30 who has, a good head of hair but losing a little bit and healthy, the cell count's probably high, growth factors. You get it from someone else who's 45 who already lost their hair, who's not so healthy, their growth factor is going to be low. So PRP is very dependent on where we're getting it from, if that makes
Yeah, on
sense.
the health of the host. It's like
It
depending
really
on
is.
the, yeah, yeah.
Even on that day when we draw it, even if they've had a bad weekend where they didn't eat right or didn't work out or weren't feeling well, basically, all of a sudden, that's why when we used PRP for like ligaments and tendons and orthopedics years ago, we used to always send it out for a testing, enzyme-linked ELISA test, it's called, to see what the growth factors were and then decide, oh, you're a candidate, you're not. The problem is in today's society, no one wants to wait for that. Patients don't want to wait for it, neither do we. So we're just grabbing PRP, spinning it, and injecting it for everybody. It works on some people. Some people it doesn't work, not because the technique's flawed, but because the process is flawed of drawing the growth factors, if that makes sense. So with that,
Sure.
we're taking that out. We're taking out the guesswork. We're just synthesizing in a lab. It also allows us to be FDA compliant, to be honest with you. That's a big thing with us. We don't want to get into uh, growth factors, stem cells, exosomes, they all work, but obviously then you're getting into a different realm there. One, they're costly for the patient and the practice to buy. Two, it's unpredictable too, what you're really getting. I think there's only 3 or 4 legitimate companies in the US that are FDA regulated to actually sell exosomes, but I see like 30 of them out there. So I know some of them are just causing it like a cosmeceutical, those kind of things.
Sure, sure. Okay, so back to what's all in this formula. So nutrients to help with the vessel network, aka like blood flow to the hair. I know there are ingredients to anchor the hair, right? Because we don't want you to lose the hair you already have.
That's a big one, yeah. So
Yep.
it's called ectopeptide 2. It's a synthetic peptide, basically. And what it does is it anchors your current hair, so you get less shedding usually after just one treatment. It's less shedding, which is great. So
That's
it's
what I hear from patients because after they come back after their first treatment, we usually say, "Have you noticed anything?" Which hair doesn't grow that fast, so they're not really noticing growth yet. But many patients are
correct.
saying, "I'm noticing less hair in my brush, whatnot."
Yeah, so that's anchoring the current hair, and then it also gives weight to the new hairs that are coming out, the little peach fuzz vellus hair, so it allows them because part of it is they just anchor. The hair follicles are like roots of a tree, roots of a plant. They have to grow out, get nutrients, but also keeps them in place. So this octopeptide 2 is a synthetic peptide that actually helps anchor the current hair until it becomes like a terminal hair, like a full-grown hair where it can actually anchor itself, if that makes sense. So yeah,
Okay.
you're right. Most people notice less shedding just after one treatment. There's a natural DHT blocker. It's copper tripeptide 1, which naturally occurs in our body, but as we get older, it gets lower. So we up the copper tripeptide 1, so it's going to help block DHT levels, and that will help stop miniaturizing hairs and those kind of things. And a lot of the amino acids and peptides, you're probably already using them topically or they're injecting them. They're just all compounded together. We got this formula of 30 plus active ingredients from talking to doctors like you that specialize in hair loss, saying what do you like, what don't you like, those kind of things. Acidic fibroblast growth factor actually helps to repigment the hair. So it's not going to dye your hair to a new color, but think about it. If new hairs grow into new healthy hair, they should come in your natural hair color. They shouldn't come in gray or white. They should be healthy hair. They're gray or white because they've lost nutrients. So the new hairs that are actually coming back in because of the acidic fibroblast growth factor is actually new hair cells. The fibroblasts are actually stimulating new hairs. So we've noticed that some people, it sounds crazy, they come back in, the hair's actually coming in their natural hair color, whether it's brown or which is kind of neat.
Yeah, very cool. So the copper tripeptide, I think you're saying helps block androgens, but also helps the growth rate too. So just
Correct.
lots of ingredients. I mean, when I was thinking of purchasing the device, obviously I wanted a list of all the ingredients in the serum, and
Yeah.
yeah, there's a lot. There's a lot of ingredients.
Yeah, and the big thing I always tell people there's a list of ingredients on one side, and then really on the right side is what's really important, the molecular weight of all of them. They need to be small enough where we can get them into the skin. So everyone always looks at this column like, look, that column's important for sure, but go over to this column, the molecular weight, it has to be a certain Dalton weight, small enough where we can drive it through. Otherwise, it's just going to sit on the skin, on the
Sure.
scalp, and it'll be okay up there, but it won't get down to the hair root. And that's part of the problem where you buy these topicals where theoretically, some of them can work, but most of them do not get through the scalp without using TED or something to kind of push it through, if that makes sense. And the key is to get those nutrients, those amino acids, those polypeptides, those growth factors into the root of the hair, so then it grows.
Sure. Has Alma done any research on exosomes, like using TED to drive the exosomes?
So, I mean, the answer is yes. We do a lot overseas. The problem in the US is then practicing medicine. Then you're getting into that whole realm, which is okay. So, I have a lot of doctors that will do this in combination with other things like exosomes. They can add finasteride, dutasteride, a bunch of other stuff that actually works really well. What we found out is the TED serum works really well by
Yeah.
itself for most of the people. For your normal, androgenic alopecia, male pattern, female pattern hair loss, when you're getting the scarring alopecia, alopecia areata, some of the other stuff that I'm sure you've talked about, they're going to need combination therapy. This is not a silver bullet. Look, I wish I could tell you, like, when I grew up in the 80s, Sunday morning with the Chia Pet commercials, that all of a sudden the hair just sprouts out, and you're like, oh my God, the TED doesn't work like that. We can't just do it and all of a sudden the hair just sprouts out. It's a process. Typically, it takes about 3 treatments for normal androgenic alopecia. If it's the tougher alopecia things, you might need combination therapy with exosomes, with some other stuff that we talked about for sure. But overseas, outside US, they absolutely use combination therapy. I have doctors in the US using it too. And again, open up the door to you. I'm sure you have some therapies that you actually use with it as well.
Sure. You kind of already mentioned this, but what differentiates TED from other non-invasive hair restoration devices like hair laser caps or microneedling or PRP or whatnot? Yeah.
Yep. So this company, we're an energy-based company. We do LED lights, which is the red caps, the red light therapy, and they work, but they're more combination therapy. We do lasers, which are more opening up channels, basically. And the problem, they can work, but once you cause like a wound, either microneedling or laser, two things happen. One, you get some shedding for sure. It's only temporary, but people don't like having shedding. Two, once you open up that channel to put the product in, it's a large enough channel. You get osmotic pressure, interstitial fluid pushing against you. So even though you may have an open wound here that you think you can put a product in, it'll seep in those holes. It won't because you have pressure working out. Think about when you're a kid, you scrape your leg or scrape your body. Things don't tend to go in them; they get pushed out. You have this osmotic pressure, this oozing fluid that comes out. So even though if you microneedle and do laser, because our first study was with laser, we have a laser, we have a 1540 laser, 1570 laser, which has been proven to help with blood flow. But the problem with that is you still don't get the same depth of penetration that you do with the TED. The reason why the TED's a little bit different is ultrasound's completely painless. It's noisy. Definitely, if you've
Yeah.
had treatment done right,
Yeah. 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 Yeah.
it's a short ultrasound, so it's in acoustic sound waves, but it's completely painless, so it makes it comfortable. Not that I don't mind the patient being uncomfortable if it's necessary, but if they're comfortable, I can treat them better, if that makes sense. You can
Sure.
treat them more
Sure.
thoroughly. You don't have to worry about rushing through the procedure. Two, the second technology is once these channels are opened up, you'll notice with your TED, in the middle of it, in the middle of the sonotrope, there's a hole. That hole actually causes that air pressure to drive it down. So
Okay.
opening these channels every 3 or 4 seconds, you'll see that puff of air. Sometimes you'll actually see a little bit of puff, and actually drives it through. So we're opening channels, driving the product through. We're opening channels, driving it through, basically. And at the end, honestly, we do it for about 2 minutes per area, but like it should be dry to the touch, pretty much. Most of it should be underneath the skin if we're doing our job properly. I'm not opposed to microneedling. I'm not opposed to laser. I'm not opposed to LED caps for sure, but we've tried them before and it was just inconsistent. I think it's good combination therapy once I get things going. Once I get the hair growing, I love LED therapy. I love 650 red light. I love some other stuff with it. By itself, it's probably not enough. And look, even though some of those things work on a microscopic level, patients want to see their hair grow back. They want to see something, they don't really care if, oh, your skin's healthier, it's more vascular. I took a biopsy and you have more blood flow. Do I have more hair? So with the TED, you can kind of see consistent results, noticeable results, usually after a couple treatments. Not 6 or 10, usually after 2 or 3.
Yeah. Sure. Okay. So, what does clinical data show in terms of measurable density improvement and patient satisfaction? Do you have any of that data?
I do, and I could maybe pull up on the screen, but basically after 3 treatments, and the reason why we say 3 treatments, it's like a bell curve. You get some improvements after one, you get some improvements after two, but after three, majority of people see a nice result. So most of our studies was initially what we call androgenic alopecia. That's 90% of the population that has hair loss. It's usually androgenic, basically. On androgenic patients, after about 3 treatments, you notice anywhere from 40 to 60% increase in hair density, basically. So thicker hairs, more hair follicles per area, if that makes sense.
Great. Yeah.
Nice. Now again, for stubborn hairs, for stubborn alopecia, like scarring alopecia, those kind of things, those studies are more like 5 treatments. Sometimes you need topical steroids. You sometimes need to break up the scarring. Usually with scarring alopecia, which is the more severe cases, Hispanics, African Americans, you see like those welts on their back. You've ever seen those
Mm,
kind of scarring things. You feel terrible for them. For those kind of clients, it usually takes closer to 4 or 5 treatments with some topicals. Sometimes we need to break up the scarring with microneedling or laser. And usually it works best if we get them between 18 and 24 months of diagnosis, not like 10-year-old scarring alopecia because the hair follicles are dead, if that makes sense.
sure.
Yeah, the success rate, look, people say, well, that's only 50% increase in density. That's quite a bit when you look at your hair, if that makes sense. Look, it's not going to make someone who has no hair follicles a full head of hair overnight. It doesn't work that way. But it's for people have thinning hair, that have losing hair, that have spots of hair, alopecia areata, those kind of things for sure. But the reason why we say 3 treatments doesn't mean you have to have three. I've said some people do two and they're happy with that. Some people do four. After 3 treatments, it was 97% happy with the treatment. That was the reason why I was 97 to 3. I was like, what happened to 3%? They were upset with the cost of the actual treatment, which is
Sure.
it's expensive. You know that,
Yeah.
the
Yeah.
cost of the treatment. So the 3%, it was, I think it was 1 or 2 people in the study. They just said that they liked the treatment, they saw a result, but they weren't happy with these things are expensive. My company sells them, you guys, market them. It's expensive treatments. I get it. So that was the only issue.
Sure. Okay. So, do we know what percentage of patients are responders versus non-responders, or are you basically saying most people respond unless they have significant scarring, significant balding? Like if you have a, white shiny forehead
Yep.
and follicles are dead, we're not going to revive dead follicles. But if there's something there, we can help what's
Yep.
there.
So 90% of the population is androgenic alopecia. On androgenic alopecia, we're above 90% results, if that makes sense.
Yeah.
The
Yeah.
only time that we have so-so results is if someone slips in where it's alopecia areata, where you have spots of hair that you lost. That's more of an autoimmune disease. We can
Yeah.
treat that, but it's
Yeah.
just a different protocol. We want to get the autoimmune under control, some other things. So, but most people, look, for our clinical study, we took hairs out and sent it to a lab and diagnosed it. This is androgenic. This is this kind of alopecia. That most people aren't doing that in practice. You're just too busy. You're not doing that. You're just seeing and treating, which is totally fine. If you see and treat anyone that has, androgenic, which is the normal pattern of hair loss, you should see, good improvements after 3 sessions, for sure.
So I want to go back to, I do have some patients with various types of scarring alopecia. So
Yeah.
are you saying this still can help them potentially?
Correct. So when we did our investigation, I was surprised that there's not anything great for scarring alopecia. I mean, it's a shame,
Yeah,
for
it's just
sure.
steroids. That's all
Exactly
dermatology has
right. Yeah.
recommended
So
to.
if
Yep.
you can use steroids first and get it under control, basically, and if you don't have a lot of scarring, if you have a lot of scarring, you might need a microneedling, just a pen, not an RF, just microneedling to break it up, or like a laser, an ablative laser to kind of break up the scarring tissue. And then we can hopefully get to the hair follicles, which may or may not still be alive. Sometimes they're just dormant, to be honest with you. If we get it within, like I said, a year and a
Sooner
half,
the
18
better.
months,
Sure.
sooner the better for sure. I don't want to mention doctors' names, but there's a couple doctors in New York and DC, female dermatologists doing some studies for scarring and those kind of things for sure. And they're getting good results. Good results meaning an improvement. Doesn't
Yeah,
mean that
yeah.
all the hair grows back, but for those people that have scarring alopecia, they're like, look, I just want some improvement. So the improvement may not be, 50% increase in density. It might be closer to 30, which is what it looks like, but still gives you hope that
Yeah,
there's an
yeah.
option for these people. Yeah.
Totally. Speaking of doctors' names, I don't know the name of the guy who invented the hair transplant, but which you probably do, but I've heard he has Ted in his office. Can you
So
speak to that?
yeah,
Yeah.
are you okay mentioning names? I don't
Yes,
know.
yes, yes,
Yeah,
yes.
yeah. So Dr. Alan Bauman's one of the pioneers of the hair restoration
Yep.
thing, transplant. We have a number of other ones down there, and he's one of the ones that we spoke to initially, and they were super nice to us. They're like, Jay, Alma, this is great, but we're surgeons. Like this seems like smoke and mirrors. It just seems like something that we don't really need. And sure enough, after about a year, we circle back, and he's one of our biggest advocates for it. And he just said, look, besides working non-invasively for people, because he's like, look, if I do 10 consults, maybe only one person signs up, if that. It maybe only 1 out of 20, like 5%, because it's an involved procedure, when you do these procedures for the hair transplant. And then he goes, then the success rate of hair transplants, I don't want to get into an argument, but sometimes it's only like 60, 70%. So 30, 40% of them fail after one treatment. Sometimes they go back for a second. So he said,
Not
look,
Ted, the hair
the
transplant.
hair
Okay,
transplants.
okay,
So you
okay.
get you pay 10, 20 grand to get a hair transplant. You go through surgery where they take a little piece out and they transplant and all that good stuff. People know that. You can watch it on YouTube or whatever the kids watch, TikTok, whatever, and then watch it. And then 30 to 40% of them fail, meaning you have to go back for a second treatment. That's crazy. So what he's doing, a lot of my transplants is one, giving them options that if you don't want to transplant, do TED. It's not the
Yep,
same,
yep.
they prefer transplant,
Yeah, yeah,
but
yeah.
they're actually doing it
But it's
before.
less expensive than a
It's
transplant.
less
Yeah.
expensive, but they're actually doing it before and after transplants. And the reason why is if they're doing it before the donor site, they're actually making the hair
Yeah.
follicles thicker, better. Then they're
Yeah.
treating the area that you're going to make it more hospitable, make sure that the area that we're putting the hair follicle will last longer. Because what happens is they take good, healthy hair here, put it up to the scalp here. The hair's healthy, but then when it gets to the scalp, it's can't get any nutrients. There's no blood flow here. That's why we lost the hair there. So they're actually doing TED before and after these hair
After. Yeah.
transplants, and they're getting better results. With that said, they can coexist. Like we were worried that this doesn't take away. If someone wants a hair transplant and they're willing to go through that and that's what they need, then that's
Yeah,
fine.
yeah, yeah, yeah.
But they can also get this before and after. But like Dr. Bauman, Dr. Ben Paul up in New York, he's a great guy. He's a big hair restoration guy. Like we have those top guys across the country, which is great. And they're all like, yeah, this is useful in their practice even.
Sure, sure. So what should patients expect? So kind of walk through a listener like what the treatment is like?
Yeah, yeah. So you come in basically, we're gonna kind of move your hair around a little bit here and there. We're gonna kind of massage your head with like an ultrasound. I will tell you, some people find it noisy when I get near like the ear canal because what it's doing is
On
it's
bone, yeah,
vibrating.
yeah.
Yep, on the bone, yeah, basically. It shouldn't be painful at all. On a scale of 1 to 10, like a 1, it really shouldn't be painful. We've never had anyone discontinue treatment because of the pain. We've had a few people complain about the noise, and it's not the big deal. We can adjust it and do some other stuff. So we're going to do this kind of, TED treatment on the air for about 2 minutes, and it's going to open up these microscopic channels. You won't feel any different. You'll notice a little bit of serum being dripped on your skin, on your scalp, basically. And then we do it for another 2 minutes on a different kind of setting. And then the frequency is a little different, so the noise is a little different. It's more of a high-pitched noise. And then at the end of the treatment, we're done that area, we go on to another area, basically. So the whole treatment takes maybe 15, 20 minutes. You're not going to notice nothing that day. You're like, oh, it looks the same. I don't really see much. What did I pay for? But in the next 2 weeks, you'll notice less shedding, which is the key to the therapy. We want to keep your hairs that you currently have and give them nutrients, and then we want to grow new hairs. The growing new hairs, like you said, it's like watching the grass grow. It's tough to see new hairs grow. But sure enough, after one treatment, less shedding. After two treatments, they notice the hair quality is just different. The hair, it feels thicker and it is thicker. And then by the third treatment, they're beginning to notice hair follicles coming out, these new little peach fuzz, these little baby vellus
Bellis
hairs.
hairs. Yeah. Yep.
Correct. Yep.
Yep.
So
So
most people like the experiment. Most people like the treatments, and most people doing the treatment, most clinicians, it's easy for you guys to do the treatments. Like I've been in practices where you're doing PRP and some of this other stuff, and it's like paper rock scissors. Who wants to treat the next patient because it's going to be painful? He or she is not super compliant. I got to draw their blood. This is much easier for everybody involved.
agreed. So just back to what we initially were talking about. So the first step is opening up the stratum corneum. The second step is applying the serum. And then the third step is pushing the serum in, which sounds like you're saying that's the kind of additional technology that the TED device has, the kind of hole in the middle of the whatever that.
The sonotrope. Yep, yep,
Yeah,
yeah.
yeah,
So
the tip.
basically,
Yeah.
there's
Yep, yep.
other ultrasounds on the market that have been shown to drive products into the skin, but usually they're superficial, like 100 microns, 200 microns. Like hair follicles are 3,000 microns. They're like 2 or 3 millimeters into the skin. You need to get deep enough to get down there, basically. So most of the others, ultrasounds, they're for skincare. They're for like vitamin C, vitamin A. They're repurposing for the hair. It doesn't mean they can't work. They just
Yeah,
don't get deep enough, and then they open up the channels, and they have nothing, no mechanism to drive the product through, if that makes sense. It's like
sure.
a 1-2 punch. We're opening the channels, then we're driving the product in. Opening the channels and driving the product in.
Sure, sure. So just I'm sure listeners are wondering, well, what about if I have hair extensions? And I will say if you have hair extensions that are removable, we would remove them before the treatment. But
Yep.
if they're the sewn in, hand-tied extensions, we can work around them. So
Correct.
just so patients know that. Yeah.
That's
But
good
I
to know. Yep.
also
Exactly. Yep.
Yeah, but I also want to share we don't treat the whole head, right? So pending where patients are having loss, a lot of my female patients are losing kind of receding
Simple.
on the front area on both sides. And then obviously if it's androgen driven, a lot of thinning on the part, kind of towards the back. A lot of men it's the back and the
Yeah.
receding in the front. So we usually treat about 5 credit card size sections. So we don't treat the whole head, but we treat these 5 sections per se. We do have patients remove hearing aids or it would be really loud.
It's true.
Um,
You're right.
but we haven't had anyone complain that it was intolerable. I mean, I fall asleep. I feel like it's a head massage. I just like, I think it's very
I mean, that's
relaxing.
part of it too. You
Yeah,
want the
yeah,
patient, like even some of the other stuff that works, if it's painful, the patients won't come back for the second or third treatment or compliance. The
yeah.
compliance is high with TED because one, it works, but two, it's not a super painful procedure. It's super
Yep.
easy to do, that kind of stuff.
Let's talk about patient selection and contraindications. So, who cannot have this treatment?
Big thing, since there are synthetic growth factors in the area, any history of skin cancer in the area. We just don't want to pump a lot of growth factors and other things on areas that had a history of skin cancer. No open wounds in the areas, those kind of things. But since it's a class one device, we really don't have that many contraindications, which is great. We're not driving in exosomes and PRP and stem cells that are sometimes a no-no. So really just open lesions in the area and then
Yep.
history of skin cancer in that specific area.
And metal. Like if you have a metal plate in your head, right? We,
Correct.
yep.
Metal's going to be uncomfortable for sure. We've had treated some people, but correct. Any of those kind of metal implants, you're absolutely right.
And then would you say, is there age range or stage of hair loss where TED works the best? Is it like where's the point where it's too late?
No, so I look, we have some people that are in their 80s and they're super healthy. They're healthier than some people in their 40s, I'll be honest with you. So I don't want to put like an age on it. Look, healthy people with all this stuff respond better. It's just how it
Yeah.
works. Our body's able to repair stuff. What we're doing is we're giving your body the right nutrients, the right building block to regrow that hair. It's up to your body now to take that and regrow the hair and start growing it. So healthier people, are a better candidate for sure. It doesn't mean we can't treat everybody. But people who
Yep.
are limping into your office, who are on a bunch of medications, who don't have things under control, that have a lot of chronic issues, we can absolutely treat them. But the better responders, like I don't want to put an age on it because I've seen some 60, 70, 80-year-olds that are in way better shape than the 20-year-olds nowadays. So I just think it's the healthier people, the healthier lifestyle people. Doesn't mean you have to be super healthy to do this. But the non-responders I see are people that have comorbid issues, other things going on, if that makes sense. They're on
Sure.
medication, not healthy, those kind of things. Your body's already taxed to begin with, trying to work itself out, if that makes sense.
Sure. You've already answered this, but I'm going to ask anyways, so can this be combined with other treatments?
Yeah, look, I mean, obviously, I have the Alma logo here, and Alma is made by Ted, but it's combination therapy. One plus one always equals three in medicine. It always works out better because we're just treating you while you're in the office for that 20 minutes. When you go home, the light therapies, topical meds, those kind of things, absolutely. We
Add
had to
up.
do,
Yep.
yeah, you're a big fan. We had to do our treatment with just monotherapy, just our system, just our serum to prove efficacy and prove that kind of stuff. But in practice, you absolutely can combine it. So if you have a patient that loves PRP, loves exosomes, getting good results, finasteride, minoxidil, no issues. Keep them on that therapy. Just add TED to the mix. If you have someone who's not a candidate for that because of side effects and issues with finasteride and those kind of things, then you can do TED solo. But obviously, combination therapy always works better.
Great. What are some common mistakes you see providers making with TED?
Um, Probably super saturating air too much. Like, look, you're putting these saturated, and the vial comes, it's like a 5 cc vial, like you said, about five credit cards areas, basically. And they think if they just do this one area five times over and over and over, you'll just grow more hair. It's like working out. You can only
Once
work
it's
out so much.
saturated, it's
Once it's
saturated. Yeah.
saturated,
Yeah.
saturated. Like you're just wasting it, if that makes sense. I'd rather treat areas that have healthy hair and just help them out, if that
Keep
makes
it.
sense.
Yeah. Yeah.
Yeah, so typically it doesn't mean you can't do more. People, try to play around with the settings. It's totally fine to do that. But our study was made this way where 2 minutes is usually enough to do the area. Can you do it 2.5 or 3 minutes? Sure, but it may not do any benefit if that makes sense. Just might make it more uncomfortable. So I think trying to overthink it too much, trying to do too much to a given area, you have to give it time to grow. The best thing I would say is maybe break apart the treatments where if it's just one area, have them come back in sooner, maybe every 3 weeks or maybe every 2 weeks instead of saturating it all at once because you're just dumping all this stuff in. Your body can't use all that right away, or just
Sure.
spread it out to adjacent areas.
So speaking of intervals, so typically these are recommended once a month for the way that we do this for patients is either they buy a package of three or they buy pack or six. I
Yep.
mean, you can always buy three and then just add on one at a time. It's just cheaper if you buy them in packages. So what is the deal, the science between the intervals? Like, is 4 weeks the sweet spot? Like, is 2 or 5 okay? Like,
Yeah.
what's the interval
Look, it's mainly because one, you have to give your hair follicle enough time to grow,
time?
and
Yep.
that takes a while for
Yeah. Yeah.
sure. We noticed that after about 20 days, after about 3 weeks, we noticed that if you do biopsies, that most of the growth factors, most everything had been used up or kind of are in the process of being used up. So at that point, you probably could treat a little bit sooner than 4 weeks. You probably treat it 3 weeks,
Mm.
maybe even sooner, especially for stubborn cases, especially for people that just don't want to wait. They're like, look, I've been dealing with this forever. I have to travel, like you mentioned, I'm traveling an hour there. Can I just come in, boom, 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 those kind of things. So we typically say 4 weeks is about right. If it's 3 weeks, if it's 5 weeks, that's okay too. But we're just giving your body a chance to kind of use up these ingredients, these nutrients to kind of grow, if that makes sense.
Sure. And then what should patients avoid before or after treatment?
So anything damaging to the hair, including like even shampooing your hair, it's fine to do it before, but afterwards I'd give it about 24 hours. We don't like dyes in the hair. We don't like any of those kind of things. If you do, that's okay, but you're just putting added stress to the hair. So we'd like to avoid any dyes, any hair treatments done, a couple days before, if not a week before, if possible. Afterwards, honestly, the epidermis should be closed up after 24 hours, but we just say, hey, no shampooing, nothing to your hair for about a day, about 24 hours.
And I tell patients don't vigorously exercise. We don't want you to sweat, right? We don't want you to wear a hat. We don't want the hat to absorb what the pricey serum you've just paid for.
Correct. No, you're right.
Yep.
You're exactly right.
So,
Yep.
okay. And then how important is maintenance?
It is. Look, I mean, we're basically getting your body back in gear, and some bodies are able where we kickstart it, we wake up the dormant hair cells, we give them the nutrients, they grow out these kind of feelers, these roots, and they're able to get their nutrients on their own. But it's always good to have a maintenance or booster. And we're talking, once every 3 months, once every 6 months, maybe twice a year, those kind of things. Now, again, most people get motivated that once they get into this, they're going to be living a more healthy lifestyle, taking supplements, those kind of things. There's medical issues that have probably caused some of the hair loss to the area as well. So I always big fan of like once you get into shape, once you eat healthy, you can't just like rip up your gym membership or stop eating healthy. Once you get your hair back and you're happy with it, let's maintain it. Doesn't mean you have to come back in for a series of 3 or 6. Just come back in once or twice a year for like a booster, and then obviously do some other things, co-therapy at home.
Yeah. I was going to ask about patient retention or patient satisfaction, but you kind of already answered that. So let me next ask, are there any new developments or next generation updates, like on what other I guess on the TED platform. I'll just keep it at
Yeah,
that.
no, for sure. Obviously, we're focused on the alopecia. Obviously, the platform can do other things, but it's an open system, meaning that the serum can change over time. Right now, we're happy with the serum, but what's neat is it's not locked into the system, not married to the system. So if we find out other ingredients, other things that are better or worse, those kind of things, the ingredients in the cocktail may change, if that makes sense. We're looking at a different sonotrope that's a little bit larger for larger areas, those kind of things, and some other things that will be, adjunct therapy. And then TED off-label in the US can be used for other applications as well besides hair loss that we talked about.
Sure. What about eyebrows?
Yeah,
Do you
we've
have?
actually, I was surprised. Eyebrows is a big market because I guess a lot of women have thinning eyebrows and a lot of them have had, dermaplaning and the pigmentation stuff and those kind of things. So we've actually got good success with eyebrows. I was surprised now the volume increase was a little lower, it's probably in the 40s, but it looked dramatic, if that makes sense. So
Yeah, yeah.
it works well. We actually have guys that do their beards, they have patchy beards and everything else, those kind of things. So I'm actually surprised at some of the
I
applications.
didn't think about beard.
Me neither. I was surprised. I mean,
Same serum, same settings, but you can
yeah.
treat the beard.
Yeah.
Okay.
Yeah.
That is very good to know. Yep. See, that's why I asked that question. Okay. So if someone listening is experiencing hair loss, what do you want them to know about TED that they probably haven't heard? Like, is there anything else you want to share that you haven't shared about TED?
Yeah, I mean, the big thing is, look, you don't want to do anything that's going to cause side effects and problems because there's other medications out there. There absolutely is medications that are prescribed and they can work basically, but you have to watch, you have to do you have to do a bunch of other tests with it. At least you should, basically. So TED is a non-invasive treatment, no needles, no pain, no side effects. We've never had a reported side effect that lasted more than maybe a couple hours, meaning a issue like someone rubbing it too long or something like that, but nothing like that. So the upside is, look, you're not going to cause any problems, not going to make any worse, and have any medical issues. The downside is, look, it's a little pricey, and you may not see results after one treatment, but it's nice because it's an option out there. It doesn't mean you have to jump right to TED. I'd go see your clinician, talk to him or her about other options. There are some topical stuff, there's some oral meds, there's some other stuff that might be enough for you. I would just start sooner rather than later. Don't wait until you have clumps of
Yep.
hair coming out. We can notice it. Once you begin to notice some hair loss, I'd come in sooner rather than later with all this stuff.
Yep. Good advice. Okay. Anything else you want to share? Do you think we about covered it?
No. Look, I'm excited. I'm passionate about what I do. I think it's great. I think we're living longer. We talked about that at the beginning. People want to look and feel better. I don't think it's a vain thing at all. I think it's self-esteem. I think it's self-confidence. I have 4 kids. I want them to walk in proud, and help put their head high. So, I mean, I don't think it's like a vain thing that, oh, I just have to have white hair. I have to have thinning hair. I have to go bald if I'm older. No, I mean, there's options out there for sure.
Awesome. Okay, last question. Well, not last question. Where can listeners find you? And I guess Alma. What's Alma's website?
Yep.
Yeah, yeah.
So it's www.almalasers.com basically. You can go there basically. My contact information is on one of the screens there for sure. I'm an open book. I've been with the firm for 20 years. I like what I do. Interested in all this new stuff. We're constantly investigating new things. And on there is a list of providers, that you can actually go to. But there's a lot of educational stuff on there as well. If you go to webinars for consumers, and the big thing now is it's educating yourself about, what options you have.
Okay, now final question. What is your top longevity tip?
Well, look, I just think, whatever you put in your body, it's fuel, it's nutrients, it's good stuff. So if you put good things in your body, good things will come out of your body, if that makes sense. You'll have a good head of hair, you'll have a good skin, good quality, your joints and everything else. And I'm not saying that you have to do clean eating and clean living across the board, but just think about if you want your engine to run well or you want your product to work well or whatever, you have to maintain it. I mean, this is our number one investment. I know we spend a lot of money on cars and clothes and everything else, but like pay a little extra for better products, for eating better food, those kind of things. So the better stuff you put in your body, the better quality of life you're going to have. You just
Mhm.
are.
Yeah, I agree. I always say our health is our best investment. So thank you, Jason, today for coming on the show, breaking all this down. I think this is going to help a lot of people understand what's possible from a hair growth standpoint. So for those of you listening, if you're experiencing hair loss or thinning and what you heard resonated with you, and I encourage you to take the next step. So give our clinic a call, 319-363-0033, or visit our website, ihhclinic.com. As I mentioned in part one, we do offer a complimentary beacon hair analysis. You can actually see what's going on at the scalp and follicle level. And from there, we can build a personalized plan for you. You may need some functional medicine labs, may need some serums as well, may need red light therapy, right, to complement the Alma TED. But we'd be happy to see you as a functional medicine patient and as a TED patient. So, as always, thank you for spending your time with me today. If this episode was helpful, please share it with someone who needs to hear this and leave us a review. This really does help people find the show. So, until next time, keep building your longevity. Take care.